welcome back to the Integrative Health Podcast with Dr. Jen. Today, we're going to be talking to Phil Micans. He has qualifications from the UK and the USA in food and vitamin technology, pharmacy, and biochemistry. He's been actively involved in preventative and regenerative medicines since the late 1980s and has contributed to numerous books, magazines, radio, and TV shows on subjects connected to healthy aging. Currently, he is the editor-in-chief of Aging Matters magazine, the assistant editor to Lifespan Medicine Journal, and the advisor to the British Longevity Society, the Stromboli Cancer Conference on Cancer and Aging, and the London Anti-Aging Conference. He's also the moderator of the Profound Health Summit. In 1991, he was a co-founder of the IAS Group, an organization dedicated to this dissemination of preventative and regenerative medicine information and the supply of hard-to-obtain health products, and has created the Profound Group, which formulates and produces innovative nutritional products. Phil is the OG when it comes to peptides and bioregulators. So it's so fun to talk to him. We've just been talking off the podcast for like 30 minutes on all the things. So we're gonna let you guys let you know all about bioregulators and peptides and what's coming up. So welcome, Phil.
Thank you, Jen. Absolute pleasure to be back with you again.
Yes. It's always fun talking to you. So what should we start with? Could you just give a little sliver of information about just what are peptides and bioregulators to those listening that have no idea?
Sure. Well, peptides, of course, are made up of amino acids. And once you have two amino acids and they conjoin, you have a dipeptide. So they can be really small and they can go on to be enormously long. And sometimes as they get really long, we change the names. We might start calling them proteins. We might even start calling them hormones. One example would be human growth hormone, which is made up of 191 amino acids. And if you take in not only the length of the chain, but also the positional makeup, I'm not a mathematician, but the numbers could be enormous. But when we use the word bioregulators, it was really, I think, founded by Professor Vladimir Kavinson, who was the lead researcher at the Institute of Biogerontology based in St. Petersburg, Russia. And what we can go right back to the 1980s here, because they've been playing with these bioregulators for a long time. But their fundamental discovery was that these short chains of amino acids, these peptides, and what do I mean by short chain? I mean 2, 3, or 4 amino acids are in food, in different foods, in different combinations. And they are really quite specific gene switches. And the word bioregulator came about because not only do they have the potential to activate certain genes, but also silence them at the same time, which is kind of really bizarre. Somebody once said to me, sounds like an adaptogen. And I think that's probably a good way to look at it. A question I posed out there, and somebody much brighter than me may know the answer to this already. Do these plant adaptogens have peptides in? Because these peptides are universal. They are in plants, they are in animals, and they are in us. One quick example of that that's pretty new is the University of Tel Aviv has been using some bioregulators in the growing of strawberries. And they found that the strawberry plants, given the bioregulators, growing 20 to 30% more fruit on them. And that number, something around that 30%, is a number that comes up again and again and again. In fact, Professor Kavinson used to refer to it as every cell has a biological reserve of about 30%. So the question is, are these natural bioregulator peptides, are they activating our cells' biological reserve? Back when Russia was the Soviet Union, this discovery was a military secret, and it was reserved for their troops, their cosmonauts, and yes, their Olympic teams. And one thing they knew for sure is they all, whichever gland they were from, they could have, there's 20, today there are 21 that are commercially available, okay? And they cover a wide spectrum of glands and organs. And they induce protein synthesis. They're nano sized. I'm sorry if I'm going off at too much detail here. So the great news is they can be used orally. Yes, they can be injected, of course they can, but they can be used orally. They avoid stomach degradation because of their size, and they're interacting not on a receptor, but directly with DNA. And they have some of the best slides I've ever seen, where you put 3D glasses on and you watch the interaction of the peptide with the gene. So, and you think, well, wow, because it's been going on for 40 years. And Professor Cavenson, who joined us at one of our Profound Health Summits, actually in 2022, he actually said on stage that he estimates that, and when we say Russia today, it is Russian-speaking countries. So it is the Ukraine and Kazakhstan and Armenia and Georgia and all the others, right? It's not just Russia. And he estimates that over the years, they have now dosed these bioregulators 100 million times, right?
Wow.
And in that time, they've never seen a serious side effect.
Right.
So,
right. Because it's working with your body. Yeah.
Yeah. And as I say, it is something really fundamental because it is in plants. They are in plants, they are in animals, and they are in us.
Yeah. And I love the 30%. So for those of you listening out there, it's almost like we have this 30% potential that we're not tapping into. And
there is an argument, this is pure theory, that, we know that the maximum verifiable lifespan is about 120. And Jean Clement allegedly 122, but around 120. I know that's rare, but it seems to, and the Bible even says, doesn't it, the maximum age is, anyway, it doesn't matter. I won't go there. But the average now in the West is about 80, isn't it? So you could even, and Cavenson this used to be his argument, if we tap the biological reserve, can we extend our lifespan by 20-30%?
right.
You know?
But that 80 in the Western world is like a rough 80. I mean, because, if their hormones aren't optimized, if they're not using peptides and bioregulators, with the right guide and the right person using them, they look rough at 80.
You're right. You're absolutely right, Jen. That was a fascinating, because this is what I do most of my time. I try and find what I think is interesting research papers and make sense of them, and then I distill them for the public so that we get something that everyone can understand. But there was a very interesting study done in Amsterdam in 2016. Of course, it's online, you can find it. And what they did is I can't remember the exact, it was all ladies, but there was 10 or 12 of them, something like that. And they were all centenarians, right? They're all over 100, except one lady who was a super centenarian, which means over 110, right? Which is rare. I mean, verifiable in the world right now, the number of super centenarians, I don't think you could count on your hands and feet. There's probably not 20 people in the world right now, 110 or over, but it's a small number. So what do they do with these ladies? Every week they took a few milliliters of their blood, okay? And they analyzed it for telomere length, and they analyzed it for stem cell activity, right? And what they found in all these ladies was, in the last 2 to 3 weeks of their life, there was a dramatic shortening of telomeres and a significant reduction in stem cell activity. Now, the big question is, of course, is that cause or is that consequence?
That's interesting. Question. Did any of those centenarian women have children? I'm just kidding.
I can't answer that off the top of my head, but I would suggest that most of them certainly did. Yeah.
Okay, well, that's impressive, because I text my husband this morning. I'm like, getting all of these kids ready for school in the morning is shortening my lifespan. I need some bioregulators.
Shall I tell you something else that they have in common? And I think you could say that across the board, very, very long-lived people have this in common too. They're quite small. They're not big people.
Well, so I struggle with that, Phil, because muscle is the longevity organ, right? So it's like, I've really been focusing on my protein intake and muscle. And yeah, I do know that the less you eat, the longer you live, abundance of eating food, that's going to shorten your lifespan. But what about the muscle?
Well, good question. I don't really buy into the people who want to actually reduce growth hormone levels with age. I mean, there's a group of people who think that growth hormone and AKA, of course, also IGF-1 would accelerate aging. I don't like that because, first of all, I'm not saying superological levels, of course, everything within the normal parameters. But having, as you rightly say, decent muscle mass is very important. You don't really want to have sarcopenia and be not able to lift yourself out of the chair when you're 80, do you? No, I don't think so. So I think within normal and of course the other answer, over the years it's been all growth hormone would accelerate cancer or that. Well, teenagers and young folks don't seem to have a big problem in that department, do they? And yet their growth hormone levels are way higher than us older folks. So I think everything within balance. I think there might be other factors. The great Jonathan Wright, who's a doctor I greatly admire, used to always say, if something goes wrong, there are probably only three answers. One, you've given the wrong molecule. Two, you've given the wrong dose. Or three, you've done the timing wrong. But I know hormones gets incredibly complicated, and if you're a pupil of, say, somebody like Dr. Thierry Hertog, there isn't a lot of people who can obtain, how do you balance 400 different hormones? It does become more. Thankfully, I think is that peptides acting as instructions in many cases will endogenously enable us to make more of our own hormones and keep things more in balance. I think that's pretty evident.
Absolutely. And when you look at the thyroid bioregulator, you can I give it to my Graves and my Hashimoto's patients. I give it to both because it's not driving it a certain way. It's just healing the thyroid. It's just turning on and off genes.
Exactly. And of course, by doing so, you're getting production of all the thyroid hormones in their balance, which is going to be very tricky to do if you're using T3 or T4. I've always, prior to the peptides, I was always very in favor of the desiccated thyroids because they did seem to improve patients a lot better. And I'd always assumed that was because you're getting the whole, I know it's porcine. And of course, the strange thing there was that I only learned this a few years ago, is that the pig thyroid happens to be bioidentical to human. That doesn't happen very often, but in that case, that is so.
Yeah. Well, let's talk about something that is new and upcoming that we were talking about before, a peptide mouthwash. I am giddy about this. We were talking about this before. I'm so excited because when you go to the dentist and they're like, oh, there's nothing you can do for enamel or gum recession and you need gum transplants and all this stuff, but maybe not.
No, it's something I've had my eye on for a while. I'm sure the people, your audience will already be familiar with it, already switched on to it. A lot of this work is coming out of Japan and also Taiwan. And we have seen in at least clinical trials the regrowth of teeth, human teeth and dog teeth, but in humans. And so something very interesting. And there was something we were touched on it earlier. I wish I could find many years ago. An older man, was struck by lightning, and he actually had many of his teeth start to regrow. So that's weird, I know, but there is a mechanism. I think if we encourage our bodies in the right way, like salamanders, we will have the ability to regrow stuff or regenerate stuff. So that's exciting. Now, what's happened, we have a peptide mouthwash, which we call Oral Tide Pro. And we were aware from the clinicals that it could regrow gum lines, that it was preventing gingivitis, and also was remineralizing teeth. All good stuff, but nothing there that could be radical, I suppose. And as I said to you, it was just today that our two of our dentist friends, sent us the pictures, before and after pictures of two patients that they have where they're actually regrowing the enamel on their teeth. So, and this is using the mouthwash once a day, just like you would do with anything. And I think the time period we're looking at, it's a few months. I've got to get a few more data, but maybe 2 to 4 months, which is pretty typical actually of peptide reaction times. I always say to folks, give it 3 months. Don't give up inside 3 months. So,
That's
but how about
amazing.
that? You could actually regrow the, and we're okay. That's not the regrowth of a tooth, but I think we're moving down that pathway, and I think we're not going to be so far away when that is going to be possible.
I mean, that's amazing. It's awesome that the dentists are on board with this, because that's going to lose them some business, right?
I don't know if the dentist is on board, but the patient's doing it and they're monitoring them. So we'll see where that leads us.
Right. And that's why I feel like, especially in the US, I know you're in England, but in the US, I feel like a lot of these things aren't well known, because it would take business away from the farm companies or the doctors or the surgeons, all of those things.
Yeah, it's a strange thing. I could recite a story here, but I'm not going to mention names. But many years ago, I worked with a professor out of the University of Texas. Fortunately, he's no longer with us. And he was I'm going back now to the late 90s, early 2000s. And he was doing a lot of research into inflammation. Now, nobody was really big into inflammation then. And he was really excited about what he was uncovering. And he actually gave a Senate subcommittee presentation where he basically said, if we monitored people for their inflammation and corrected it, we could avoid many, many, many problems, right?
Yes.
Well, I'm not going to mention names, but he was, after the presentation, he was taken to one side by a senator, and he basically told him that they would never implement anything like that. And when the professor said in shock, why not? The answer came, because you would disrupt a $3 trillion a year industry. What would we do with all the unemployed doctors and nurses? So that's the thinking, right? That's the problem. But here's the thing. In England, we have a saying, which is we call somebody a Luddite. Now, you might not know what that means. It's very British. But back when the cotton mills first came with the Industrial Revolution, the guys and girls who used to literally stitch clothing suddenly saw these, these huge mills being operated by steam or water mills or whatever, mass manufacturing clothes, and they smashed them up, the machines, and they tried to burn down the mills. They became known as the Luddites because they said, we're going to make us unemployed. Now, what actually happened, of course, was due to the mass availability of clothing and the fact that it got cheaper, even more people were employed in a different way, right? But more people were employed. And here's my argument, right, about health and medicine. What's our current model? Our current model is you wait until you get sick, you then go and see someone. It may already be too late to do anything of any significance for you, but nonetheless, you're coming at it from the other way. If you wait for your car to blow a con rod because you never changed the oil, you wouldn't do that. So that's our current model. By definition, there can only be so many people seeing doctors, right? I don't know what that number is. Let's assume for a moment it's too many, obviously, if you sit, but let's assume for a moment it's 10%, right? So so the whole industry is being driven by a certain percentage of the population who wants to get well again. Now imagine for a moment if that was completely the other way around, and what we were actually practicing was preventative medicine, so that you never became sick. Well, by definition, you might have to go to a preventative medicine doc, say once a year, twice a year, like you might do to a dentist at the moment. Well, that's all the population. That's certainly over a certain of age. You might, I don't know, we could arbitrarily say that's over 25 or 35 or whatever we want the number to be. But suddenly a much bigger percentage of the so guess what? We could need more people working differently and trained, just like the Luddites, right? So I'm quite hopeful actually that it wouldn't lead to less employment, but what AI is another matter.
Yeah.
That's a different thing. But I actually quite hopeful that actually the future generations of doctors might find themselves very busy in
Yeah,
a
I
good way.
agree. Yeah, we need to think about it differently. It's kind of like everyone's like, oh, LDL causes heart attacks, high LDL cholesterol. And it's like, no, inflammation causes it, or it's also the mindset in the US, preventative medicine is getting a mammogram or a colonoscopy. No, that's just detection. That's nothing preventative at all.
I like
Oh,
to say
my
that
pet peeve.
it's state of the art. Get it? State of the art,
Mhm.
not state of the art, state of
Yeah,
the art. But dogma and vested interests
yeah,
always, whether it's the oil burning cars we have or whatever it is, they don't want to get rid of the existing technology too quick because they haven't got their returns on it. And
right.
most people in the public think, yeah, I know that's true in the oil business, and I know that's true in banking, and I know that's true in but they never want to think it's true in health and medicine. They always think that that's sacrosanct in some way and that it's untouchable. But,
Right.
you know,
Right. Yeah, especially with mammograms. That
uh,
technology is so old. It's so,
ridiculous.
and
If
I
a
don't know.
man had to have his testicles examined in the same way, we'd
All right.
probably go back and burn the place down to the ground.
You're right. You're
How
right.
you ladies put up with that is beyond me. Now, my wife, she has thermograms about every
Mhm.
6 months. Hey, what's wrong with that?
Right.
Take a
Right.
photograph. That's easy and
Right.
more accurate.
Yeah.
So no, mammograms are a joke. There's no question.
It's really backwards. Well, let's get back to bioregulators. So you said there were 21 different bioregulators. Now, can you explain what that means a little bit?
Well, they are commercially available. They come from different glands. So just to name a few: pineal, thymus, thyroid. But there are others like blood vessel, kidney, liver, pancreas, adrenals, muscle.
Mm,
So there's quite a parathyroid. There's quite a few. There's quite a few. And I did an interview with Kevinson a few years ago now where we talked about synergy, where we talked about which combinations of peptides for different problems. We we put most of this into our Aging Matters magazine, which people can go and find and download for free. So, and of course, we've been trying to get more. In the Russian clinics, they use injections as well. We could go into that. They do some remarkable work with eyesight conditions,
mm,
which there's a clinic in St. Petersburg called the Tree of Life Clinic, and it's run by Professor Svetlana Trofimova. And she, for example, treats all kinds of eye problems, but one she treats, let's see if I get the name right, um, uh, it's a retinopathy, not diabetic, but no, it's not diabetic. But I'm going to forget the name. Sorry, it's an inherited problem. There's no clinic in the world that treats it except there by using various retina peptides and other things. So and of course when that's the kind of thing is very visual because she shows before and after. They do these fundus photographs or they do these computerized topological of the eye, and it's very easy to see what was black, i.e. no eyesight, is now green,
mm.
and so the reversal is quite remarkable. One lady in particular I'm thinking of right now, an elderly lady who was 90% blind in one eye, and after treatment was 30% blind in that eye. Now you might say, well, that's not a cure, but it isn't. But it took her from not seeing really anything to now being able to get around the house okay and see the grandchildren, and it gave her back some of the quality of life that she was missing before.
Okay.
So
And they're doing injections.
now they are injections. In that particular case, they inject it subcutaneously into the skin surrounding the eye, into the orbit
Oh,
of the
yeah.
eye. And then
Okay.
they do that for 10 days. And then the patient goes home with 2 or 3 peptides. The retina peptide is the main one in
Mm,
this case. Blood vessel peptide, because it's synergistic with them all. And they take 2 capsules a day, every day, until they come back and see the clinic again.
mm.
So that's the basic protocol for those patients. As I say, there are injectables. Unfortunately, they don't export the injectables. But the good news
Right.
is that the orals are active and they can be enlisted as food supplements. We're working very hard at the moment with a brand that we're going to call Nature's Marvels,
Mm-hmm.
and they're exactly the same material, only they're going to be produced in the UK.
Mm-hmm.
So that is going to happen by the end of May.
Super
By the end of
exciting.
June, we should have all 21.
Mm-hmm.
Now, I'm not going to get into politics, but that will negate the whole issue with sanctions that we currently have, right?
Yeah.
Because they're
Right.
not over there, they'll be over here. And we fully anticipate them being distributed in America as well. We're working with 2 well-known lawyers in the States and another group so that we meet the Dietary Health and Supplement Acts. And they, despite them being assembled, as it were, in the UK, they are produced in FDA approved facilities. So we
Really
think
exciting.
we've checked all the boxes.
Yes, yes. Now, when you go to take these oral peptides, you said that they are absorbed really well because there's so little in the gut. So does anyone, if they have maybe low stomach acid, would that affect their absorption? Do you take them before or after a meal, or does it not really matter because they're so
It
small?
it doesn't really matter, but we generally advise to take them with food. Um, they are a bit more fat soluble than water soluble. That's
Mm.
true. So food, but also, let's be honest, most people won't forget to have breakfast, lunch, or dinner. So if you say that's the time to take your dose, then it's a good reminder.
Right,
As soon as you
right.
break that cycle and say, oh, 2 hours after lunch, go and take them there, that's when people are more likely, in my opinion, to forget. So generally speaking, around food is what we say. But here's the good news, of course, you don't have to take them every day. That's
Mm.
another thing about these. So let's go back to our thyroid that we started talking about a little bit there. When you take these peptide bioregulators, you're sending those messages to those specific genes, in this case, that are responsible for the manufacture of thyroid hormones, not, so you're not just invigorating T3 or T4, but T2 and etc. Excuse me. And of course, you're doing that endogenously. You're not taking the hormone. And it would appear that in most cases, and there are differences here between the synthetics and the naturals, because of course these bioregulators can be produced synthetically. The naturals last longer, right? Now, that means that although there is a slight caveat to this, the normal regime, okay, is to start on what they call the intensive dose. The intensive dose is 2 capsules a day for 30 days, right? So that's 60 capsules, obviously. After that, you go on the maintenance dose, and the maintenance dose is 2 capsules a day for 10 days per month. So that's 20 capsules, right? In some cases, you can back off to every 3 months. It does depend on the need. But basically, the signaling in general, depending on the condition of the patient, etc., is somewhere between 1 and 3 months. So all you're doing is topping up, if you will, that signaling to keep, in this case, keep nudging the thyroid, get back to work.
Yeah. Yeah. And
So
like going back to that 30% reserve, maybe it just wake up, let's go,
yeah,
we
it,
gotta, we gotta
it's all
keep
there. Now,
manufacturing.
at this point, I'd like to tell you the story of my Italian surgeon friend and what
Mm,
he's done at the University of Rome, because leads straight into what you've just said, Jen, the reawakening. right? What do we want out of our future medicine? Yes, we want it to be preventative, but if we've got a problem, we want it to be regenerative. Why not? So,
Yeah.
so this gentleman's name is Valerio de Nicola, right? And he was working with the and you can look him up on PubMed, you'll find him. And he was working with the University of Rome. Now, the University of Rome asked a very good question. They said, lots of people having knee and hip operations. We all know that. But there are frail people, elderly people, who are sometimes refused them, even though they need them, because there is a risk in the procedure, particularly for the hip, of course, which is really quite a major operation. So they actually are posed the question, is there anything that can be done to help those people? When they'd finished their research and conducted their trials, it turned out they can help everybody, not just those people. So what am I talking about? So what they did is they discovered that the heat shock proteins that are in our blood can reinvigorate the mesenchymal stem cells to actually go and repair the cartilage. Now, what they do, and they in the published study that you'll find on PubMed, you'll find 400 patients in that trial. However, the last time I spoke to Valero, he thinks they've done over 2,000 now, right?
Wow.
And on those 400, they followed up on them 5 years later. Now, these were folks who were like, say, 45 to 75 in age, okay? Every single person was told you need a new knee or a new hip, okay? What they did is they took 10 milliliters of their blood, very small amount, obviously,
Yeah.
and this is where a lot of the research went in. They effectively tortured that blood. They heated it and cooled it. And it's very specific. And so through that process, your own blood, our own blood, releases its heat shock proteins, right? And when it's finished, and I've seen it, it looks like a piece of tacky red chewing gum. That's what I would describe it as, right? Now, this is where the surgeon needs a skill, but let's say it's a knee. The surgeon needs to know, Valero said there can be up to 13 places, if I remember rightly, where the mesenchymal stem cells are residing on the capsule of the knee, right? They make 3 millimeter cuts, very small, right? I mean, you've done worse when you fell off your bicycle last time, right? Where over those mesenchymal stem cells, they then push back in your heat shock proteins, and then they might put a stitch or two, right? So in other words, you came in the day before, you gave your blood, you came in the following morning, you had your blood reinserted, and you went off to a nice lunch in Rome, right? Job done. No, there's no real time spent in hospital.
Sign me up.
Some patients, it's amazing, isn't it? Some patients needed a second procedure. A few patients needed a third procedure. What happened? What happened was within 10 days, the pain went. And we know why. And I'll go into that if you want me to. Over a period of 1 to 3 months, the cartilage regrew, and there was no need for a new knee or a new hip. And 5 years later, those patients still didn't need a new knee or a new hip.
Yeah. Now, for those listening, I mean, you can't do this stuff. Like, there's nothing that you could be offered like from your orthopedic surgeon. I mean, we do PRP here. It helps. That's what I had when I tore my meniscus. You're getting some stem cell action, but not growing. You're not growing cartilage. And, you know, they mess around, Phil, in the US here with the Symvisc, which is from, you know, the comb of the rooster. And that does absolutely nothing for anyone, I feel like. But I mean, is this place taking patients still?
No, unfortunately not. It's not taking commercial patients this time. It's something that a friend of mine is working very hard to get. There are a few clinics in the world that are getting close. There's one in the Bahamas, one in Mexico, one in Cyprus. We're hoping for one in London or somewhere in England anyway, but they're not quite there yet because there are so many regulations around blood, even though this
It's
is
your own
your
blood.
own blood. and no
Yeah.
drugs or other mixtures are being added. It's heating and cooling. So there's no drug component to this. Just quickly on the pain. See, I think there are two issues that most people will do something about very quickly. One is joints, because it troubles you every day. You get out of the chair, ow. You get in the car, ow. It reminds you every time you move. So that's one I think people do something about quickly. The other is eyesight. If people see their eyesight disappearing, I've got to get this fixed. So whether that's good or bad, I don't know, but that's true. I'm going to lose my train of thought now. So that's on that side of it. But so the pain, I was going to say the pain. So I had the pleasure of being with Valero for 3 days, and he gave me a deep dive into this. And he was saying, I said, so what is the pain? I said, I don't know physiology very well. I said, are we talking about, I'm aware that on the knee joint, for example, you have the bone, the cartilage, and the synovial fluid. And we know ways, of course, to how to improve synovial fluid. Get into that if you want to. But it's a bit like a shock absorber, really, isn't it? It's not much different. So I said, are we talking about bone on bone when you get pain? He said, no. He said, if it was bone on bone, he said it would be excruciating. That was the word he actually used. So he said, actually, he said, I'll tell you what most of the pain comes from, and it's not even cartilage on cartilage. So, okay, interesting. What happens in most older folks, right, is their cartilage has become overcalcified. And what happens is the nerves that are residing within that cartilage are now, due to the calcification, have been stretched into an unnatural position. And therefore, when you move, your nerves are letting you know. The first thing this treatment actually does is it softens the cartilage. And hence the nerves go back into their normal position. And that's why typically within 10 days, no pain. Pain's gone.
It's amazing.
So, but this leads me into a story we touched upon earlier, which is this information all exists all around the world. I've got some facts and figures for a presentation the other day, and at the moment there are 1.5 million medical publications every year coming out, right? And yet it's been estimated that perhaps less than 20% of the world's information is online. So most of the world's information is still in the libraries. And of course, those libraries could be anywhere, and they could be in multiple languages. How good's your Chinese? How good's your Russian?
Right.
So I would love to see a situation. I know it would be an enormous job, but we'll live in a fantasy world for a moment, where AI, imagine if all the world's information was on a database and AI dove in, and you put in your problem. You said, I want to know about, I don't know, bowel cancer under these conditions, and AI would come back and say, these are the publications you need to check out, right? Bosh, 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 like that. Imagine if that was possible, we would actually learn what we've already discovered, because this is the problem. This information is out there. It's been done, it's been researched. It's, I could talk about other stories that I've come across in the 35 years I've been doing this. I call them the wow factors. But then everyone goes, why isn't that being done? Why isn't that, well, there's all kinds of reasons
Exactly
that happens. But in the first instance, you've got to know about it.
Right. Yeah. Yeah. You do. And that's the thing. People don't know about peptides. People don't know, about heat shock proteins, a lot of these things. It's, yeah, there's so much out there. And then we do have to reproduce it. The US is very difficult to get some of these things in. So that's why, like you said, Bahamas and different places have clinics where you can go and get these groundbreaking procedures.
I think a lot of these smaller countries could lead the world in medical tourism. And clearly,
Absolutely.
somewhere like Mexico, I'll take these states as an example, somewhere like Mexico, somewhere like the Bahamas could serve the states very well, East Coast, West Coast, that sort of thing. Don't have to travel too far. Same in Europe. If we go, a lot of people now going to Turkey, for example, in Europe. But, Cyprus would be another good example. And you could even say, oh, I have a nice holiday and I go and get that
Right.
done as well. So, but that may be the way forward because small countries, by definition, are more adaptable. They can change if they can change. The Bahamas is actually considering many changes to its laws to make much more innovative medicine
Oh,
possible in the islands.
oh,
So I
that's
know
great.
that for a fact. So, and they won't be the only ones. So moons ago, 2015, in fact, I went to a Novartis meeting that took place in Basel in Switzerland. I don't normally go to regular drug meetings anymore, but I was intrigued because they said there would be a panel on aging.
Hmm.
And I went along, and there wasn't many people in the room. There was maybe 50, but there were some big, people from the Buck Institute and the NIH, and big people in the room, and little old me. And but I heard the number of debates going on, which I was fascinated by. And people were asking, if we do preventative medicine, which country will approve it? And that's where I got involved and said, I don't, because they were talking, or will
Mm,
it be America or the UK or China and I had to stand up and say, no, it won't be any big country. It'll be a
right.
little country because, if you can go and have lunch with the president of wherever, right, you
Yes.
might actually get something done,
Right.
So that was my point. But I can tell you then, the chairman of Novartis came up, big man, came on that stage in 2015, and he actually said, I'm paraphrasing, but he actually said they were going to concentrate their research on the diseases of aging because they recognized it at the center of degenerative disease. I nearly fell off the back of my chair for someone
Right.
like that to say that, because that was a corner turning moment. And I think it's no accident that within months of that was towards the end of 2015, within months of that, we suddenly had the announcement that the FDA would agree to the metformin trials, the so-called mice trials in metformin and other trials like that. So,
Hmm.
you know, these things, it's not an accident that these things happen. So we have turned a corner, but we've still got a fair way to go.
Yeah, that's really exciting. Well, now back to peptides and talking about how they are regulated. Do you feel like injectable peptides, it's just, we're all probably going to be taking a break from that and focusing more on oral, or do you feel like there's still safe places to get
Let,
them? Because the
let's
compounding
be honest.
pharmacies
Let's
are
be
out.
honest. If you're a label reader like me and you buy a lot of these injectable vials, most of them say what? Not for human use, for
Right.
research and R&D only.
Right.
So none of our regulatory authorities are going to like that, right?
Right.
Um, my worry is that they will bring laws in that will ban those substances altogether, even if it's for R&D in a Petri dish, right?
Right.
Because they'll say you're not really using. That's my big worry. Some of the peptides that people are talking about cannot be considered to be to fall under the Dietary Health and Supplement Act, for example, to quote the states. Fundamentally, it has to be natural or at least mimic a natural molecule. Some of them don't. So, I mean, injections by themselves are drugs. If you put vitamin C into a vial and say inject that, it's a drug, right? That's the definition. It's the delivery system. So yes, I do feel that some people are walking on eggs, shall we say, when with those. The advantage of the peptide bioregulators is they come from natural sources. Most of them come from pigs. Some come from cows, but most of them come from pigs. And there will be some from plants, I'm sure, in the future as well. It's just the readily available sources and we. Oh, by the way, I should mention here that as I've already said, the size of the peptides is nano, and whilst they come from healthy animals, they're filtrated to such a point that no Dalton-sized molecule, no prion, could ever be in the product. So there really isn't. And by the way that they're actually extracted and used, there is actually no DNA and no animal tissue. Because sometimes we get our, religious friends who won't eat pork, for example, who say, "Oh, I don't know if," and I say, actually, there is no pork in it. That's from a scientific viewpoint. So the good news is they come from food, therefore they should, I should say, fall under the Dietary Health and Supplement Act, and they are effective orally. And as I think this has also been backed up by an American doctor called Dr. Bill Lawrence, who's in Atlanta. And Bill now has 150 patients in his trials, most of whom are medical doctors, rather strangely. And he's been basically replicating this published Russian research. And, he's found a lot of interesting things. He's done tests that, of course, the Russians weren't really privy to 20 and 30 years ago, or certainly were very difficult. For example, he tests the telomere lengths of his patients. He tests the DNA methylation, the so-called Horvath clock of his patients. And I'm delighted to say that he's had improvements in virtually all cases. His last time I spoke to Bill, and we're holding a Profound Health Summit in England this May, and Bill's coming over to give us his latest results. I'm not privy to them yet. He's just alluded to them to me. But previously, he was saying that the average telomere length, because he uses the biological age measurements, in this case, the so-called tele-age, the average patient improves their telomere length by 5 to 6 years. In other words, biologically younger. The best patient result was 9 years, just to put that out there. Everybody knows that DNA methylation is much tougher to shift. However, even small, according to Stephen Horvath, even small increments can have significant improvements or detriments, depending on which way they go. But Bill, what he's got me excited about, and why I'll be riveted to my chair on that lecture, is he's going to be showing evidence of organ regeneration in his patients.
Amazing.
So that's exciting.
Yeah. Yeah. And that's what we were talking about before, that 30% reserve, and actually, or like growing teeth and that kind of stuff. It's amazing what our bodies can do when given the right environment and the right recipe. It's all about the recipe. And it's also, with peptides, bioregulators probably not as much. Peptides work a little bit better if you are, if you're getting good sleep and you're getting good nutrition. I mean, bioregulators, they work better if you have your gut health fixed.
Absolutely. First of all, little story. I love little stories. Little story is, if we think of our body as a building site, right? And you're going to make a new house. I don't know, wherever the problem is, right? I'm going to make a new house on the building site. You need fundamentally two things. You need the materials to be available, right? The bricks and the cement and all the rest of it. And you need the workers and the instructions to be available, right? If the boss doesn't turn up one day, i.e. the genes, right? And we've got no instructions, well, guess what? Nothing's going to happen. But likewise, if the boss is there, but there are no materials available, nothing's going to happen. So going back to thyroid, you're still going to need the building blocks to manufacture those hormones. But when you have the building blocks and the instructions, then you have something happening. Bill Falloon from Life Extension, of course, and also the Age Reversal Network, has nice slides where he views it as a house. And he says, here's the floor one of your house, is the ground floor. And, you need to get the basics. You know, it is not an excuse to drink 20 pints of beer every night and eat 10 McDonald's in a day, right? You've got to get the basics right. You've got to get your biochemistry at least somewhat sorted. But when you then add on these emerging, whether it's adding vitamins and minerals and peptides and some hormones or stem cells, suddenly your house is going to be very strong, very robust. So, but you can't have one without the other. It just isn't going to do it anyway. I wish it was an excuse to do no exercise and eat and drink whatever you want. My God, I do, but it ain't.
Doesn't work that way. Well, Phil, let's wrap up a little bit. How could people find out more about the work you're doing? I know you put on the Profound Health Summit once a year. How can people get more involved or learn more about your company also?
Thank you. Well, our biggest information site is called antiagingsystems.com. So that's antiaging-systems.com. And we have, I think, over 1,000 pages of referenced information, podcasts, webinars, videos on there. And we have a pretty good search engine, I hope, that you would be able to find most of what you want. And of course, we've got contact pages there. So if you can't find what you want, you've only got to send us a message and we'll link up. From there, we can direct you to stores where many of these things can be purchased, but for various reasons, the information is disassociated with the sales. So that's what you can do. On top of that, of course, we have a YouTube channel and all that stuff. But if you go through antiagingsystems.com, you'll go to those resources. And if you want a sort of lighter look at it, then our magazine, and which is called agingmatters.com, aging-matters.com. And to point out, you can spell aging with an E or without an E. So you can spell it the American way or the British way. It won't make a difference. Okay. And although my oldest brother, every time I see him, likes to rub me up by saying, still doing the anti-agging. But but no, and by the way, although you can purchase the magazines, physical copies, for $12, you can download them free of charge. So
Amazing.
and we upload when we're not a regular magazine. We used to be, but I got to the point where I thought I don't want to be, because of the calendar, I'm forcing to come with a magazine and regurgitate stuff. And so I try now to produce magazines when we really do have something new or fresh to say. So and we mix it up. We mix it up. Do we talk about medicines? Yeah, sometimes we do. Do we talk about hormones? Yeah, sometimes we do. Do we talk about peptides? Yeah, sure, sometimes we do. Do we sometimes even talk about other things like fasting, or things like that? Yeah, we do. So, we mix it up.
Yeah, that's awesome. And it's amazing that you provide so much free resources and information. So what you're doing is just amazing. And it's just been so fun to talk to you. And we were talking like a half an hour before the podcast too. It's such a delight.
My pleasure. My pleasure. Shall I leave you with a joke? I'd like
Yes, please.
So people say when they talk to me, they say, Phil, you are very educational. Well, they don't use those words. They say it taught them a lesson. But
I love it.
So, but you know what? We will not progress anything unless we share what we know, right?
Yes.
And that's the way forward.
Yeah, absolutely. Well, thank you for sharing everything, and we'll have to have you on again sometime soon.
I look forward to it, and I'm looking forward to your summits are coming up next month, and I shall be watching those as well.
Yes, absolutely. Thanks, Phil.
Thank you. Bye, everybody.
Bye.